Talk about back pain for a minute because it will affect about 80% of Americans at some point in our lives. The good news is most people will never need surgery, but the bad news is for many the pain can last a lifetime if not treated. So how do you find relief and even prevent back pain from starting? Dr. Cam Momi is a spine surgeon with Coastal Spine in Mount Laurel, New Jersey, and joins us this morning with some great tips. Good morning.
Good morning.
You know, when you talk about back pain, golly, it seems like everybody has something wrong with their back. Is there a certain age where we all kind of start to fall apart a bit?
Well, basically around the age 25 or 30, the body starts to degenerate, meaning age internally, just like it does on the outside. And what that means is the discs, which are between the bones, start to change and start to show signs of aging. Not everyone has back pain, though.
Yeah, sometimes you can have a wear and tear and it doesn't actually cause the pain?
Exactly.
Okay, so about 90% of people will never have to have surgery on their back.
Correct.
But they will have some type of pain. And what are some of those things that we need to know if surgery is not an option for someone who has extreme pain?
Well, the most important thing is to try to get, first of all, if the pain lasts more than about a month to 6 weeks, see your doctor, get an MRI, get it evaluated, and to figure out, to make sure it's nothing serious. Once it's not anything serious, then a combination of physical therapy, the correct type of physical therapy, strengthening, taking care of yourself, basically, to strengthen the body as much as possible is really the only other option.
Yeah, a lot of people think when they have a back injury or just back pain in general from maybe perhaps not even an injury but just getting older, wear and tear, that they should not move around as much, that maybe if they keep still that'll make it feel better. But with physical therapy, what we kind of learn is that you need to get some blood into that area and really move it a little more, right?
Exactly. The discs themselves actually don't have a very good blood supply. So exercise is very important to bring oxygen to the area, and not only that, but exercise also decreases pain levels in general. We found that the amount of pain people experience, depression, all that improves with regular exercise.
Is there any one part, as we look at the spine here, which is, it's a beautiful spine, but is there any one part here that's more fragile than another or that gets more wear and tear on your body when you're getting older?
Yeah, there are three main parts to the spine. One is the cervical, which is the neck area.
Right up on the top here?
Yes, this is the base of the skull, so this is basically the neck area.
Okay.
The neck area, because it's mobile and moves around, can undergo degeneration just like the low back can.
Okay.
But because there's not as much weight up here, it generally does not cause as much problem.
Okay, so that's our first major area.
Right. The lumbar spine, however, which is where these large discs are, and here you can see an example of a herniated disc.
Yes.
But these large discs in the bottom are the ones that degenerate and give people low back pain.
Okay.
The section in the middle, because of the rib cage and the lack of movement in that area, because it's more of a protective part of the body,
right.
The thoracic or chest area does not move too much as far as the discs are concerned.
Less wear and tear.
So this is the least likely to cause problems.
I actually have degenerative disc disease down in my lower lumbar, so part of that is physical therapy. Part of it, as you said, getting the blood flow through. And then, Dr. Momi, how about just posture? That's a big one, isn't it?
Yes. When we're sitting, we all tend to slouch a little bit, and that does put more weight on the discs because the discs are actually located in the front of the spine. So when you lean forward or slouch, you're actually putting more weight on them.
Yeah. Sitting
upright with the shoulders back, the chest out, really is the best way to sit, and we all forget to do that.
This is the perfect job for me because I'm a big sloucher, so it forces me to take care of my back by trying to sit up.
Right.
Good advice this morning. Thank you very much for being with us. We appreciate it.
You're welcome.
Dr. Cam Momi is with the Coastal Spine in New Jersey, if you'd like to check him out.